Hi, my name's Cynthia, and today we're going to talk about early childhood caries and smoking while pregnant. Now, what is dental caries? Dental caries is a multifactorial causing disease, meaning a lot of things can cause caries, also known as cavities, such as behavior, environmental, and also biological. Caries is a transmissible disease, meaning you can pass it on from person to person. Meaning, if you have a cavity, you can pass on the disease causing bacteria to your child from a simple kiss. Do dental caries increase during pregnancy? No. Dental caries do not increase when you're pregnant. It is a myth that the child takes minerals from the mom's teeth. Contributing factors to cavities. Things that contribute to you having caries would be your diet, also unavailable fluoride, also neglect from your oral hygiene, high carbohydrate diet, and also poor saliva quality, meaning like a dry mouth. Dental carie prevention when pregnant. In your diet, you can include karyostatic foods, meaning these are foods that have low risk of you developing cavities, such as cheese, nuts, proteins, sugar-free gum, gum that contains xylitol, like for example ice cubes, they contain xylitol. Also, discourage eating a lot of carbohydrates, such as donuts perhaps, or pizza, and also bread. Bread has a lot of carbohydrates that could increase your risk of having cavities. Fluoride, while you're pregnant, is very important. Just brushing your teeth with toothpaste that has fluoride is great in preventing cavities, because if you have a little small cavity, using the fluoride will help you remineralize your tooth and keep that cavity away. One of the good things that you could use to prevent from you transmitting a cavity causing bacteria to your child would be just chewing on xylitol gum. That will be really beneficial, and it's been proven that a woman that has cavities or caries could just chew a couple gums a day, like for example 6, no more than that, because it could cause diarrhea. And then this will help prevent you from transmitting the disease to your child in the future. What is childhood caries? Early childhood caries is any cavity or any restoration, such as a filling, that a child has had before the age of 6. Signs of early childhood caries developing. Tooth decay might start appearing as a white spot or a white line along the gum line on any tooth. More advanced caries could be brown spots or even hollowed tooth structures. Support breastfeeding, but also do not allow your child to breastfeed all night. Only do your feeding once and then remove the child from the breast. Putting a child to sleep with a bottle at night is really high risk of them developing cavities because the milk sits on their teeth and that causes demineralization and cavities. Also, when using a sippy cup, please try to avoid using juice in a sippy cup or soda in a sippy cup, as to this causes the eating away of the tooth enamel. Introduce your child to a sippy cup at 6 months of age. Remember, avoid giving them soda or juice in their sippy cup. And then introduce weaning about 12 to 14 months of age. When your child has no teeth, wipe the gum with a gauze, as to you are cleaning their gums from excess milk. And when it comes to the sippy cup or the bottle, do not let your child walk around with a bottle in their mouth or the sippy cup. One of the major ways to prevent childhood caries is to take your child to the dentist as soon as the first tooth erupts. When you take your child to the dentist, talk to your dentist about fluoride varnish. It is safe for children as well as babies. Usually in good consideration, 3 to 4 times a year, a fluoride varnish application is recommended. When the first tooth erupts, it is also encouraged for the parent to brush that tooth or any other teeth 2 times a day with child or children's toothpaste that contains small amounts of fluoride. Sealants. Now, sealants are a hard, milky, protective coating that go on the top of your back teeth. And this will prevent a child with high risk of developing caries from actually developing cavities. Tobacco use and the usage of tobacco while pregnant. Did you know that about 10% of pregnant women reported using tobacco smoking during the last 3 months of pregnancy? Risk factors associated with tobacco use during pregnancy. Babies born while the mother smokes can cause certain birth defects, such as cleft lip or cleft palate. This cleft lip and cleft palate could also have your child develop caries, as well infections in the respiratory tract, middle ear infections as well. They have difficulty breathing, and they also cannot feed like any other child. They have a more difficulty in doing this simple task of just eating or drinking a bottle. They also have a speech delay and will probably most likely need speech therapy, and they have a hearing loss as well. Another side effect of smoking while pregnant could be preterm labor, meaning that your child is going to be born before 37 weeks of gestation. So they could be born low weight, less than 6 pounds. Smoking during pregnancy can cause preterm labor. meaning that your child is born before 37 weeks gestation. This could cause your child to be born with low birth weight, as well the lungs may not develop. Your child may be sick because of this preterm labor and stay in the hospital longer. You could go home and your child will stay in the hospital for a long time until they are ready to breathe on their own. The causes of tobacco on your oral health. Some of the causes of using tobacco would be losing your teeth compared to non-smokers because of gum disease, as well having a hairy tongue, bad breath, tooth discoloration, and an increased risk of developing oral cancer. Do you need help quitting? One of the helpful contacts that you could reach would be smokersfree.gov. Also, their phone number is 1-800-QUIT-NOW. The only real way that you could avoid any pregnancy complications to you and your child would be to quit now.